Most children we see have signs of sleep disorder breathing. They have worn teeth, they have tongue ties, they have crowded teeth, or if they have all the baby teeth are touching, which is bad. It doesn't mean that they're going to get straight teeth. It means that when those permanent teeth come in, there's not enough space. It means that there's oral dysfunction, could be a poor swallow pattern, open mouth posture. There's a causative relationship between open mouth breathing, sleep disorder breathing, and ADHD-like symptoms.
I'm Rachel.
And I'm Jessica. And this is All Things Sensory by Harkla.
We are both certified occupational therapy assistants, and together with Harkla, we are on a mission to empower parents, therapists, and educators to help raise confident and strong children of all abilities.
On this podcast, we chat about all things sensory, diving into special needs, occupational therapy, parenting, self-care, overall health and wellness, and so much more.
We are here to provide raw, honest, and fun strategies, ideas, and information for parents, therapists, and educators, as well as other professionals to implement into daily life.
Thank you so much for joining us.
Hey there, welcome back to All Things Sensory by Harkla. I'm Rachel.
And I'm Jessica.
And we are going to blow your mind today with this amazing interview. We're so thrilled that you're here, and we are going to interview Dr. Clayton, and a lot's going to happen. Just prepare yourself.
He's a functional dentist. So we are going to talk all about what that means, what it looks like. We're going to talk about the airway and how it relates to ADHD. We're also going to try to give some tips for parents, therapists, whoever you are, of things you can do to help not only yourself and your oral health, but also your child's, your clients, and some different steps you can take if you are working with a child who is struggling in these areas.
If you are in a spot where you can watch this interview, we highly recommend. We have Dr. Clayton in office with us, in studio, in office. I don't know what you want to call it. He's here with us. He's local. It's amazing. Let's jump in and meet Dr. Clayton. Hello, Dr. Clayton. Welcome to the podcast.
Thank you. I'm very excited to be here.
We are happy to have you.
We ask everyone 5 secret questions before we get started.
Okay. Bring it on.
Yeah? Okay.
Yeah.
What song do you secretly love but are embarrassed to admit?
That is a good one. I really like... well, it has a curse word in it.
That's fine.
Okay.
Even better.
Okay. All American Bitch by Olivia Rodrigo.
I don't know
if I know that one either. I don't think I know
play it.
Yeah, let's do it. It's got some fun teenage angst. It's good when you're feeling the emotions, like Olivia hits just right.
Oh my gosh. Is it a new song?
No, it's been out for a bit.
Oh, what was it called again?
All American Bitch. And they've got a censored one too, but you'll have to censor that.
Is that it?
Uh-huh.
I mean, we can't listen to the whole thing. That'll take be here forever.
Once you get to the chorus. But her music just... I don't know what it is. When I first heard her music, I'm like, yeah, cool. Another pop artist.
Yeah. But then it really hit you, and you're like, wow, I actually really like
and you get to the chorus, and then it gets banging. It's
we'll
fun.
have to listen to it later.
Yeah. Okay.
There you go.
All right. We're on like the hidden stuff and secret stuff for our secret questions today. Do you have any hidden talents or hobbies?
Hidden talents or hobbies?
I'm preferring hidden talents.
Okay.
But if you don't have any, then a hidden hobby is fine too.
Okay. Hidden talents. I mean, I would say something, it's hidden in the sense I just don't talk about it, is I'm a pretty good cold turkey endurance athlete.
Wait, cold turkey?
As in, like, I can...
You can just go run 10 miles
and last summer or last September, I went and rode 373 miles from Banff down to Whitefish and didn't train for it.
Oh, gosh.
And did it in 3 days.
And your recovery was fine?
Yeah.
Oh, gosh.
Okay.
So.
I'd say that's a pretty hidden talent. A hidden talent and a hidden hobby.
Yeah.
Apparently.
Oh, I love it. Yeah.
Oh, wow.
Okay.
Yeah, it's fun.
Maybe you're a sensory seeker.
Yes. Yes,
We have
I
talked
am.
about it being genetic.
I know.
So,
In extreme quantities.
Yeah.
Yeah.
Oh my goodness. Okay.
what's the most unusual item you carry with you daily?
I think unusual based on maybe what's accepted socially in our culture today is a purse.
Oh.
So this, I have my fanny pack today.
Yes,
but,
I'm a big fanny pack fan.
yeah, but I have a leather purse my parents brought back for me from Italy, and I've used it almost every day
There
for the
you
last
go.
2-3 years.
I love that. Have you
I
gotten
hate-
any like weird looks or anything, or has anyone said anything? Or you're just like, whatever.
I don't care.
Yeah, absolutely.
So sensory thing, I can't stand having anything in my pockets. Phones,
okay.
Sensory
wallets.
Can we get to the question before you answer the question? Number 5. What is your sensory quirk? Okay, go.
I
Wait,
hate.
I thought it was going to be you can't have anything in your pockets.
Oh, I've got a lot.
Oh, okay. So
I
that
have
is
a
one
lot
of
of
them.
sensory quirks.
Okay,
A
great.
lot.
List them. Let's hear them.
Okay, chewing noises.
Oh, misophonia.
can't-
You're in the wrong profession for that, aren't you?
It's not bad. I do have some patients that will like when I'm working in between things, and it drives me absolutely insane. But wet tile, I can't stand the feel of wet tile
On your feet?
On my feet. It just
Okay.
it just drives me up a wall.
Okay, like a visceral reaction, like nails on the chalkboard
Yes,
type.
yeah,
Okay.
very visceral.
Okay.
Yeah, hate wet tile. I don't like wet concrete. Wet socks.
Yeah.
No, that's fair.
Yeah,
Do you like cotton balls? Can you handle cotton balls?
yeah,
Okay.
yeah.
And then nothing in your pockets.
Nothing in my pockets, and sound. I don't like loud sound. Is very dysregulating for me.
And competing sounds
Yes.
and things like that.
Yeah, I think that comes from having kids.
Yeah, I
think
I've always had it since being a really young kid.
Okay.
Oh, okay.
Like I didn't like fireworks. I didn't like anything with loud noises. It made me feel very unsafe.
Yeah.
And so that's persisted. And conveniently, my number 2, my watch has gone off saying that he's at 105 decibels.
Oh no.
And he has an attachment disorder. And before we got him, I mean, he was in therapy for over 2 years.
Yeah.
He would have tantrums day and night. And the longest one was 4 hours.
Oh no.
And he can scream for multiple hours and not go hoarse. I've never
my
heard that
word.
kid hoarse in his life.
And here you are just like losing
my gosh.
your marbles
Yeah.
at the sound.
Some of my lowest points in my life have been during those tantrums.
Oh, I bet.
Yeah.
Oh, I bet.
Yeah.
So that's been interesting.
Navigating your own sensory needs, throwing in kids in the mix, kids with their own needs too.
Oh, yeah. Yeah.
It's a good time.
Well, you're
Yeah.
in the right place.
I know. That's why we love following your content, why we
Yeah.
have for so long, is because
Yeah.
we've needed a lot of help.
For sure. What's
So.
your biggest regulation strategy with sound in particular?
With sound, earplugs.
Okay.
So I have a pair of Loops earplugs that I wear a lot, and those help significantly.
Yeah. Good.
That and a lot of therapy, and box breathing.
Yeah. Have you tried something like the listening program with advanced brain technologies?
No,
That
I
could
haven't.
be something to look into.
Or
Okay.
Vital Neuro.
Vital Neuro would be a good
I
one too.
am
Yeah.
Totally open to all of it.
Yeah.
Yeah, that would be a good one.
Yeah. Okay.
Well, we had one more question before we got to the sensory quirks, but
Oh,
that's
we
okay.
did, yeah.
That's okay.
Number 4.
Number 4.
I'm curious.
How do you take your coffee?
How do I take my? I like lattes.
Lattes. Okay.
Yeah, I like lattes.
We were wondering. We have a lot of people answer that question with, "I don't drink coffee," so we were wondering if you actually drink coffee or not.
Okay.
We always ask it to the wrong people, and they're like, "I don't drink coffee," and we're like, oh, "Okay, well." So we're glad that you
Yeah.
actually drink coffee.
Yeah, I do.
Good deal.
Lattes. It's a great order.
Okay, now that we all know your deepest, darkest secrets, tell us who you are, what you do, why you do all the beautiful things.
Okay. I am Dr. Clayton. I consider myself a functional dentist. I got into this sphere of treatment about two and a half years ago.
Okay.
And what I'm passionate about in dentistry is that functional approach of approaching oral health as it connects to systemic health. Something that is missed in dentistry at large is an overemphasis on teeth and tooth health and cosmetics and beautiful smiles, when in reality the mouth is connected to so much more. You know, everything that goes into our gut comes through our mouth. You know, if we're mouth breathing, that's extremely detrimental to our health if the gums are inflamed, bleeding at all. So that I'm passionate about that functional approach, and also intercollaborative care. So that is what I do in a nutshell.
Was there something that triggered your interest in this area?
A desire to find purpose in the job.
Because you were just practicing regular dentistry before.
Regular
Yes.
dentistry.
No,
Is that what it's called?
Yeah, like regular conventional dentistry.
Conventional.
Just
Did you feel like
focusing
it
on
was
teeth.
just not, it wasn't like satisfying you? You just felt like your patients weren't doing the best that they could? Like what went wrong in the traditional dentistry pattern that you were like, we can do something better?
It just didn't feel right.
Okay.
And it started in dental school. Halfway through second year of dental school, I seriously considered dropping out.
Because of this, that you felt like it was
because of this that I felt. I just felt like we were going through all the hard sciences, you know, learning a lot of great stuff with pathophysiology and biology and behavioral management and pharmacology, all the things that you need to become a doctor. But yet what was most emphasized was technical work. It was fixing teeth. We didn't have an emphasis in actually healing
or preventing
patients or preventing.
Okay.
My school was unique in that we did have some good instructors and programs in place to teach us that oral medicine component. But what was missed was the emphasis. Everything was on, you have to get your restorative credits. You have to do so many fillings and so many crowns and so many of these to be able to graduate. It wasn't on, you have to do so many, you know, diagnostic exams or preventative, and we do have some, but it just wasn't the fun thing or the emphasized thing. So it just didn't feel right. And so I was pretty unhappy, pretty depressed throughout dental school. And then afterwards got into the workforce and just thought, this still doesn't feel right. Like I'm tired of treating teeth, especially with aggressive treatment, which is just standard.
Yeah.
And so that led me down a road, and Instagram helped me find this approach, because as I searched for things, and the algorithm started pushing content to me that was more and more functional and more and more conservative and modern. And then good patient questions, patients asking me questions, me not knowing the answers, them looking for the answers, and unpacking more and more and more.
Well, I have to throw Jessica under the bus a little bit, because the other week she listened to a podcast. She always comes in and she's always like, I listened to this podcast, and gives us the dirty details. And she goes, the dentist is a scam.
Dentistry is a scam. That's what I was like.
Exactly. And so I was like, I've got to get your take on that, because I mean, there's a lot of interconnectedness here, and there's a lot of things that I think that a lot of professionals could be doing better, like the things that you're doing. And just the fact that she said that, and now we're having you on, you gotta give us the dirty details.
Well, and let me tell you who I was listening to is Stacey Whitman. Do you know who she is? Dr. Stacey Whitman. So I was listening. I think she's been on a couple of podcasts recently, but I was listening to her on Mind Pump.
Okay.
And I loved that episode, and I was like, yes. Well, and I've talked about dentistry, and like, because I don't get mad. I don't go to the dentist on a regular basis, but I have pretty good oral hygiene and health, and I've never had these big issues. And so I've always been like, why do I need to go every 6 months if I am not having problems? And maybe you can educate me on that. I can see by your face you don't like it.
Part of it. Oh no. This is what's really funny being a dentist, and I don't even like just the title, the label dentist. It just gives me the cringe. I just don't like it. And DMD are the 3 letters behind my name, and it stands for Doctor of Dental Medicine, but they switched the M and the D. And so I wish they called us oral health doctors, or doctors of oral medicine, or oral health professionals instead of dentists. But why the 6-month thing is Insurance.
Yeah. Well, and
Insurance
that's
will
kind
pay
of
every
what
6
I
months
figured.
for cleanings,
Yep.
pay every year for x-rays.
Yep.
And so insurance dictates the treatment model.
Just,
I was even told in dental school when I asked, like, why don't we do onlays, as alternatives to crowns because they're more conservative.
Okay.
And I was told by professors, insurance doesn't pay for them.
Yeah.
So you'll just wait
just
at
another-
a teaching institution?
Another piece in the medical model that is dictated by insurance companies.
It's insane.
Yeah.
It's insane.
Yeah.
It makes it really hard for the industry to shift. When
Yes,
so much
it does.
of the industry is reliant on insurance.
For sure.
And if insurance won't pay for it, they're already having to chase down reimbursement money. So they're not incentivized to change if it's going to make their life harder, and they're going to get paid less.
Yeah.
Exactly.
So
Yeah.
Exactly. Okay. Give us the foundational principles of.
Wait, he was going to tell us why dentistry is a scam.
Oh. Well,
We were
I
gonna go
think.
into
I mean, I
that.
think just that is as far as it's insurance that I feel like is a scam in the sense of we are so focused on just fixated on fixing putting out fires, fixing problems, and not getting to the root
the
of it.
root cause. Yeah.
So the continuing education world is one of the hot things is surgery, doing implants and replacing all, a patient's entire teeth, and all their teeth, instead of the focus on how do we go upstream and figure out why people are thrown in the river, and instead of just fishing them out when they're drowning.
Yeah.
And so in that sense, and it's driven by insurance, just prevention is not emphasized.
Yeah.
And that's the fatal flaw. And I feel like insurance is responsible, and then the dentists need to wake up. But it's hard to do when the prevention is such a quiet voice.
Yes. And we see that a lot in our industry as well. I mean, and basically in any medical profession,
Sure.
you see that,
yeah.
right?
That gets reimbursed by insurance.
Exactly.
Yes.
Exactly.
Yeah.
Okay, so now give us the foundational principles. Like, what is holistic dentistry? What sets it apart? What's the biggest difference from like going to a traditional dentist that Jessica doesn't want to do?
Yeah.
Why should she come and see you instead?
So when I do my exams, I take an hour and a half. So where I used to do 10 minutes for a new patient exam, I take an hour and a half. We don't do a cleaning that first appointment. And that's because I have to understand what's going on to be able to properly diagnose oral health issues, oral diseases, and how it relates to the body. So for example, if a patient's getting a lot of cavities, it's not a matter of, are you brushing? Are you flossing? Do you use fluoride? Which I'm sure we'll get to the fluoride question later. But that's the question asked in dentistry. And are you eating too much sugar? And it's missing so many components. And they're not asking about hormone health. They're not asking about airway health. They're not asking if patients are breathing through their mouth. They're missing so many different things, and that's where the functional approach comes in. And then we look at everything else. We look at gum inflammation because that can severely impact the health. It can affect fertility. It can affect. It's a risk factor for breast cancer, Alzheimer's, high blood pressure, diabetes. So looking at the patient, okay, if you have inflammation or bleeding anywhere, what's the cause? Let's figure it out.
Wow.
Yeah.
For example, estrogen dominance. So if I see a patient with a lot of gingival inflammation that's female, that's not pregnant, something I ask is, have you had your hormone levels checked? And okay, if not, please go get them checked.
Yeah.
And
They're probably like, you're a dentist. Why are you telling me this? I bet they look at you like,
yeah, they do.
This is weird.
But then they say thank you.
Yeah.
Because no one's mentioned it. And we can catch signs of diseases that have been otherwise missed.
Wow.
By just looking at the mouth.
That's
So
crazy.
those are
I had
some
no
examples.
idea.
Yeah, it's really fascinating.
Yeah.
It's also because you didn't listen to the podcast I sent you.
I know. Did you know that?
For example, there was a study.
Talked about that. Yes.
There was a study performed that took a significant sample size and that couples that were having trouble conceiving, and then they screened them and identified couples in which the male partner had some degree of gum inflammation or gum disease. Wow. And when they treated the disease and got the patients healthy, within 3 months, the majority of those couples had conceived.
Get out.
That doesn't surprise me,
Dead
though.
serious.
Does that surprise you?
So
I don't know if it surprises me. I just never have thought about that.
yeah, sperm count, sperm motility, quality, all of that increased after the gingival inflammation was treated.
How do you cure the disease?
That's a good question. We need to, in my practice, we take samples of the saliva, we send it to a lab, and we get a report on the most dangerous bacteria in the mouth. And then we know through evidence-based research what we can do to treat each one. So we may use xylitol, we may use a gentle oxidizing rinse, we may use an oral probiotic. In severe cases, sometimes we need to use an antibiotic.
Yeah.
And then we can retest and see that we've gotten rid of those bacteria. So we get the bacteria down, the bad bacteria down to a non-detectable level, so the good bacteria can regulate the health of the oral environment. And then we see absence of bleeding, absence of inflammation, decrease in the risk of cavities.
Wow.
A lot of...
Well, that was one of the main things that I learned when I was listening to Stacy, was that our mouth has a microbiome of its own, and that influences everything, just like our gut microbiome influences everything, And I just thought that was fascinating.
Yeah.
So, and like when we use a traditional mouth rinse, we kill that microbiome, right?
Oh, yeah.
Yeah.
Oh, like
Yeah.
a mouthwash?
Yeah, mouthwash.
Oh, yeah.
Yeah. Like I stopped using mouthwash a couple of years ago because I heard about it or read about it somewhere, and I was like, no way. And so I stopped using the mouthwash from the grocery store and haven't used it since. And
Yeah.
But all has food dye in it, too.
it probably does.
It
Yeah.
does,
Like
yeah.
the blue and green.
Uh-huh.
Yeah.
Yeah.
And most of the toothpastes as well that are available at the store and pharmacy
Yep.
are also harmful to the oral microbiome.
Yeah. I also heard that like having essential oils in your toothpaste is not great for your mouth.
Yes.
Right?
And the thing with essential oils, and people love to come after us, especially the essential oil lifers.
Yeah.
I know those that are most dedicated to it. But I like to approach everything with an evidence based approach.
For sure.
Essential oils, it's a Goldilocks scenario, as I like to say. The research shows that too little essential oil doesn't do anything. Too much will kill human cells. And just the right amount can be beneficial to killing the bad bugs, whether it's on the skin or in the mouth. However, if companies aren't testing, if they haven't done testing in a laboratory, if they haven't done testing in real life in patients, you can't know whether it's harming, not doing anything, or helping. And so that's my issue is you're better off to not use toothpaste or not use a rinse than to use something that's not been tested that could be potentially dangerous.
Sure.
So
we're all just over here brushing with water.
yeah. I mean, the most important thing is removal of plaque. This whole idea that we have to have toothpaste is totally just indoctrination. Any product that goes into our mouth should be treated as a medication. And if the oral microbiome is healthy, we shouldn't be using toothpaste. We shouldn't be using rinses unless it's something that's very gentle, that's maintenance. But in reality, what I say is if you don't have something good to use, don't use anything.
Yeah. Okay, do you use toothpaste?
I don't.
Oh, gosh!
I don't.
I just ordered the zebra toothpaste, that's like supposed to be
Send
good.
it back. Send it back. And that's the problem is there's so much misinformation and lack of information out there.
Yeah.
And companies are profiting big time off of this belief that we all need toothpaste.
Yeah.
And it's a misconception.
Okay, what about tongue scraping? That's got to be something
Tongue
beneficial.
scraping is great.
Great.
Yes.
Okay.
Tongue scraping is removing the buildup of dead cells that contribute to bad breath and oral microbiome, a lack of a balance of the oral microbiome.
Okay.
So that is good to do.
So if someone has really bad breath, that's a sign that the oral microbiome is off.
Can be out of balance, yeah.
And you use toothpaste in order to fix that, but then the toothpaste is making everything worse.
Potentially.
For the love.
So that's why and something that we provide, and we can link this in the show notes, something that we provide as a resource is a letter template to send to an oral health care product company to request for disclosure of testing.
Interesting.
And, you know, companies that have done testing should be willing to send you a report saying, yeah, we've done this, it is safe, it's effective.
Or they would have it on like their website or something like that, right?
But most don't.
No.
Most don't.
So they don't have to.
I like to say, toothpaste and rinses fall under the cosmetic category of FDA regulation. So there's a general laxity in the tests that need to be performed. And I like to say, unless a toothpaste or a rinse is killing people or making them sick, there's no reason. There's way too many companies for investigation.
Yeah.
Or even to confirm that the tests that are technically required have even been performed.
Mm-hmm. Wow.
Yeah.
Okay, do your kids use toothpaste?
I was just gonna like gear it towards kids too, yeah.
Yeah, our kids will use Elementa. So Elementa, it's real simple. It's 5 ingredients.
Okay.
And I like that one because they've done their testing. You can go online and download a 40-page plus scientific document that explains how it works, why it's safe. And they do regular heavy metals testing to make sure they are consistent with their product. They've paid for third-party testing. The owners told me that they've invested nearly $800,000 in R&D and safety and efficacy.
Wow.
You won't find that from any other company.
Okay, what was the other one? Fig?
Stacy, the doctor who I listened to, she created her own line of like toothpaste and stuff. I can't remember. It was like Fig or something like that.
Have you heard of that?
Something like that.
Give us the details.
Okay, I'm gonna be really hated for this though.
This is why we have podcasts, right?
I call a lot of these products like Fig good intention products, and so again, I'm coming from a desire to see the evidence behind products. So Boca Rise Well. They don't have evidence. They'll point to studies done about the hydroxyapatite that's in their product, but it piggybacks on studies done for a different product. So it's like taking a recipe for cookies and then doing whatever the heck you want to it and expecting to get the same result. You're not going to.
Okay.
And so that's the product with something like hydroxyapatite is if you haven't done testing, it could be doing absolutely nothing.
Yeah.
So that's the problem. Fig of all the brands is one of the most simple. So while last time I checked, they don't have pilot studies or testing available on their website. Hopefully they do now. It's been a bit since I've checked and verified that. At least their product is very simple and the ingredients list is much shorter
and cleaner.
So we don't want the hydroxyapatite.
The hydroxyapatite.
That's what we don't want. I thought we did want that.
So nanohydroxyapatite is a step up. It's a huge step up from Crest products, from any of the bulk products, even Tom's and David's and.
I heard that Tom's was purchased by Crest. I think it was Crest. Like kind of secretly, and then they changed the ingredients and changed the formula.
Surprised.
I heard that somewhere, maybe on that same podcast.
And David's has been tested and found to be positive in heavy metals like lead.
Oh man,
for the love.
Yeah, so it's disappointing.
Yeah,
it's disappointing.
So basically, brush with water.
Yeah.
Right.
If you have a healthy mouth, either use something like Elementa that's tested.
Okay.
To be safe, and I have no ownership in the company. I will disclose that if people use our affiliate code, we do, like most affiliate programs, receive a small kickback.
Sure.
What's the code?
Do you know? We'll list it in the show notes.
Yeah.
I think it's changed.
Okay.
And so we'll list it.
Just because I'm going to use it, and you know,
we have our resource that we'll list in the. I can give you to list in the show notes that has our product guide to all of our favorite products.
Yeah, perfect.
So what I was thinking was, we have a variety of listeners on this podcast, and a lot of them are parents of kids with special needs or sensory challenges. And a lot of times we get the question of like, how do I help my child brush their teeth because they can't tolerate the toothpaste or they can't tolerate the toothbrush in their mouth? And I guess this is good news for them that they don't need to be using the toothpaste, right?
Yeah.
So they can keep it simple and maybe just brush with water.
Yeah, especially if there are, if the child doesn't tolerate the flavor of a toothpaste or the texture, okay, then that's okay. What's most important is plaque removal.
Right.
Disrupting the microbiome on the teeth is what's most beneficial.
Right.
Okay.
And then using a supplement like Xylitol right after brushing or probiotic can be very helpful. So I would preference something like Xylitol or probiotic after brushing.
Like one like
a regular
mint?
Yeah, like Xylitol mint. There's hard candy, there's suckers. So something like that afterwards, because that Xylitol specifically targets the bad bacteria that cause cavities. Oh. But Xylitol is also is also a prebiotic.
Oh.
And so the whole study on Xylitol being dangerous and causing cardiovascular events was very misleading.
Makes sense.
And funded by
I was going to say who paid for it.
Big Sugar.
Yeah.
An American, Heart Association, which also gets funding from, a lot of big companies that produce terrible products.
Well, the American Heart Association was just under fire for trying to go prevent, I don't remember what it was. Was it the food stamps that they were trying to not let them prevent people on food stamps to buy the sugary sodas or something like that? It was in the news recently.
Oh.
And then they had to back off because the public was like, the American Heart Association's doing what? Promoting sugary drinks? Not cool.
It's terrible. And that's how a lot of these big organizations are. I mean, ADA, you look at the American Dental Association, some of their biggest backing comes from, Procter & Gamble, and these other big companies that produce products that are harmful.
Wow.
And so it's troubling, to say the least.
Speaking of harmful, tell us about fluoride.
Okay, good topic.
Specific to our kids.
Yeah,
we'll focus specifically, especially on our kids.
So daily fluoride, big no.
Yeah.
Big no. There, recent comprehensive study that came out of California. It was the court opinion after a lawsuit that has been pursued for decades, literally, where there's a very large body of evidence that is conclusive that fluoride, topical fluoride in toothpaste and rinses is dangerous, unnecessary exposure, especially because our water is fluoridated at large, and then fluoride is added into other products. Also, fruits, vegetables, produce. If the water used to grow the plants is high in fluoride, that fluoride integrates into the plants.
Louise.
So then adding extra fluoride to a child's or an adult's daily routine is proven to be harmful over the long run.
I see a lot of studies about the IQ and how it can really negatively impact the IQ of children too.
Yes, it can. And something that I do preach as well is the evidence, which is interesting too. The evidence from the American Dental Association shows that daily use of a fluoride toothpaste or daily rinse, the level of evidence is considered expert opinion. So it hasn't even been measured. The only thing that's been measured and proven to be effective at reducing cavity risk is a twice a year application of fluoride. So I will propose that to patients as an option. I treat everything as a medication that goes in the mouth. So if a patient's really struggling with tooth decay and open mouth breathing and has a lot of risk factors, the consequences of tooth decay can be infected teeth, then chronic infections in the bone, which affect the body. So I always say it's worth considering a topical application of fluoride twice a year because the evidence shows that is most helpful. And what that does is it makes the teeth 10 times more resistant to acid. And cavities is an acid problem, not a sugar problem. So again, it should have always been used as a medication.
I see.
And it's become the general solution for every cavities problem. It's what I learned in dental school. Yeah. High strength fluoride, high strength fluoride, high strength fluoride. And if it's really bad, then a really harsh rinse. Wow. And as long as you do this, it works. It's like, yeah, as long as you do that for the rest of your life, that's what the evidence shows works.
Jeez.
So it's pretty disheartening.
Okay.
Yeah.
But
wow.
there's the reality just based on the evidence.
Yeah. Yeah.
It's just all such a scam.
Yeah.
Wow.
I want to talk about airway breathing, disordered breathing, because what we see is a lot of like ADHD symptoms that come from this, a poor airway, disordered breathing, poor sleep, because a child is mouth breathing all night long. And how does that relate to dentistry?
Oh, yeah. So I screen every single patient, whether it's whether they're 6 months old or 70 years old, for airway or sleep disordered breathing. And it is endemic. I mean, most patients that I see, adult patients, are too narrow. They don't have space for their tongue. Yeah, you're raising your hand.
Check. Yep.
Most of us are. And then most children we see have signs of sleep disordered breathing. They have worn teeth. They have tongue ties. They have crowded teeth, or if they have all their baby teeth, all the baby teeth are touching, which is bad. It doesn't mean that they're going to get straight teeth. It means that when those permanent teeth come in, there's not enough space. It means that there's oral dysfunction, could be a poor swallow pattern, open mouth posture. And as you said, all of that there's a causative relationship between open mouth breathing, sleep disorder breathing, and ADHD-like symptoms. And bedwetting and so many other things, chronic fatigue, failure to thrive as far as kids not growing and falling behind their sensory issues with food. So a lot of things, chronic tension in the head, neck, and shoulders, torticollis in young kids.
Yeah.
And so much of it is linked to airway. And when we address the airway and get kids, adults, teenagers, babies breathing through their nose at night and correcting tongue posture, we see wonderful things happen. These symptoms go away. Bedwetting goes away without any extra training.
Yeah.
Kids are able to focus better. They're more regulated. They feel better. They start growing better. Their jaws are wide enough. They have room for all their wisdom teeth when they become teenagers and young adults. So it's
amazing.
Yes.
So what are some things that you do in your practice, but then what else can parents be doing at home to help this?
That's a great question. So in my practice, I make a lot of referrals to other providers. One of the best resources we have today are myofunctional therapists. They're wonderful, and that is something that parents can do at home, in the sense of there are lots of providers that you can access virtually, and then meeting with them, having them evaluate your children, and then getting a game plan. You can do these daily exercises with your child. If you do them twice a day, you're going to notice huge differences. I mean, I have a patient that within 4 weeks stopped bedwetting, stopped snoring, started sleeping better, started growing more. I mean, these are things that are life-changing.
And they were doing myofunctional therapy.
Yes.
And then you layer in, other therapies like craniosacral or physical therapy or chiropractic care. OT, yeah, so many other specialties, and you layer that in, speech language pathologists, then we see even greater results.
It's amazing. It's amazing how one little thing can impact the body so much.
Yeah.
Well, I mean, like Jessica said, we'll see kids come in with a diagnosis of ADHD, and we're like, oh, well, look at their mouth is open the entire time we're seeing them. They're snoring at night. And I think a lot of people immediately go to the ENT, which is great, but also they don't it's not a functional approach. They're like,
No.
let's take the tonsils out, let's take the adenoids out.
Sometimes that is warranted. I feel
Sometimes
like.
it is,
Like if
for
they're
sure.
so
Sometimes it is, yes.
swollen,
Yeah.
then yes, let's get them out.
But why are they swollen? Probably from
Because
mouth
they're
breathing.
breathing through, through their mouth. Yeah. And
for
we'll
years and years.
And we'll see a reduction in tonsil size when we
really?
get patients breathing through their nose. So unless the tonsils are massive, say let's get them breathing through their nose first, and then see what happens. Because surgery is surgery.
And there's always a risk.
There's
of
always a risk.
something.
Yeah, there's always a risk, and it's uncomfortable. And you know, I'm sure I wouldn't be surprised if you've seen oral sensory issues post surgery.
Oh, for sure.
Definitely. Yeah.
Yeah, so it's a big concern. But do you want to hear something mind blowing?
Yes.
I mean, you've already blown Rachel's mind like 20 times. My mind's also blown, but not as much because I kind of already knew some of the things.
So this is the recommended treatment flow for treating kids with sleep disorder breathing and sleep apnea.
It's not going to be good.
And it's from the American Academy of Pediatricians. So it was put out in 2012, and I can link that in the show notes. But
Great.
It hasn't been updated since then.
I last checked in November, and it hasn't been updated.
Whew.
So flow is sleep study. If the child is snoring, not sleeping well, do a sleep study. If they fail the sleep study, mind you, the body's going to do whatever it needs to do to thrive, to breathe.
Yeah.
So a child can be have sleep apnea. They can be obstructing at night, not breathing for 15 seconds, 20 seconds, terrible sleep, and pass a sleep study.
Of course. Great.
Because the body's going to do whatever it can
Yeah.
to thrive.
What do they have to do to fail the sleep study?
They have to be suffocating, basically.
Perfect.
The sleep apnea has to be severe enough, and the compensations, and the child's not compensating enough
Interesting.
to that causes a decrease in blood oxygen saturation.
So it's actually pretty difficult to fail the sleep study.
It can be difficult.
Interesting.
So they fail it. First line of defense is take out the tonsils and adenoids.
Right.
For sure.
A lot of the time, within 6 months, snoring comes back.
Yeah.
So
Naturally.
if that's the case, then to keep the airway open, they recommend putting the child on an intranasal steroid. So let's give this growing child a steroid nasal spray every day.
Oh my gosh.
Okay. Love that.
And if that doesn't work, let's move on to weight loss. Yeah, so a weight loss plan.
But what if the child's not overweight?
Then if the child's not overweight and the steroid isn't working and the tonsillectomies didn't work, then let's put the child in a CPAP.
For sure. Yeah.
And that's where it ends.
Gosh. Wow. That's where it ends.
That's where it ends. There's no mention of myofunctional therapy, of body work, of occupational therapy, of tongue posture, of jaw size.
That is disgusting.
Interesting.
Yeah.
That's so
Oh,
crazy.
It
my
is.
word.
Oh, and by the way, they put out a statement saying tongue ties don't
Yeah.
exist.
Yeah.
That they're overdiagnosed and they're dangerous and they
Yep.
don't impact patients.
Yeah.
When we have so much evidence
Oh, yeah.
that shows that they do, and that approaching a release properly, intercollaboratively,
Exactly.
can be life-changing. It can be that extra step
Yeah.
to getting a patient better.
Yeah.
Whether they're
amazing.
6 months, whether they're 2 weeks old or 70 years old.
Yeah.
I mean, I'm going to go that route. I don't know if I'll need the tongue. I mean, my tongue is pretty tied, but I have to widen first. And the other thing that's so fascinating, squirrel brain, but your face shape changes when you have a tongue tie. Have you seen that study where they plugged the monkey's nose for 3 months or something and his face elongates and then they unplug it and it shrinks back up?
Yeah.
Or not shrinks, but like widens back up?
Yeah.
Isn't that, I mean, look at me. My face is like so long, so narrow. I'm like, oh, well, look at my high arch. Like,
So
it's
is your
all
brother's.
tongue tie.
I see it every day.
My brother has always been a mouth breather. Even when he was little, we always made fun of him for it, and no one knew.
Yeah. And then once they, there are things that we can do. Some patients, depending on what the airway looks like, some adult patients, we can avoid expansion. So if there's not sleep apnea, if there's enough airway space, if there's enough tongue space, then we can with OT, physical therapy, craniosacral therapy, Myofunctional therapy, of course. It will, and if the tongue tie restricts, what we're looking for is a posterior restriction. Lifting up the tongue and saying, oh, how far can it move?
Yeah.
That doesn't mean much. If the tongue can't get up in the back, which we can't see unless we have a 3D x-ray, then we can do everything, but we're not addressing that mobility. So in your case, if we check all the boxes of like, okay, airway's big enough, arch is small, yes, but you do have sufficient space for your tongue, you have sufficient airway space in your nose, then doing all those therapies and about 4 to 6 weeks into myofunctional therapy and body work, we'll know.
Interesting.
If you still can't keep the tongue where it needs to be, and we look in the x-ray and you can't get the back of the tongue up, then we say, okay, the release is what you need, not to release the front of the tongue, but to release the back of the tongue, which then pulls it out of the airway, and that can be a missing piece.
Yeah.
And that's the function. And it needs to be intercollaborative.
Yeah, absolutely.
Not every tongue tie needs to be released.
Yeah.
Or should. It can actually make patients worse.
If it's not done intercollaboratively.
It can make sleep apnea worse.
Okay.
Well, if you're not training the tongue how to move and where to go and how to be, that would make sense.
Yeah.
Why it would make things worse.
100%. Because
It's
now
just
you have
flopping
more
around in
tongue
there,
mobility.
doesn't know what to do.
Yeah.
It's just flopping around.
It's true. Oh my gosh, yeah.
I'm just over here like trying to lift the back of my tongue as you're talking. Like, can I do it?
Mine's just like overflowing into my teeth.
I could totally do it.
But if we don't have enough space, then the solution is surgery to get more width of not just the jaw, but the nose.
Oh.
So the correct, most modern surgery expands the entire maxilla, which is a triangle. If you look at the top of your nose between your eyes and you trace a triangle down to the sides of your jaw, upper jaw, that is the bone we need to expand.
Oh, dear.
So where conventional medicine's also gotten it wrong is they just break the upper jaw and move it, but that doesn't change the width of the nose.
So everything will just go back.
Well, not necessarily that it'll go back, but the roof of the mouth is the floor of the nose. So if we can expand the entire bone, which changes face shape, then, if we expand 8 millimeters, 10 millimeters, well, guess what? Now the nose is that much wider to get air into.
Wow.
Yeah.
That's wild.
It's crazy, right?
Yeah.
It's exciting.
It is.
I'm just thinking of like patients that I've had who went and, had ADHD symptoms or even a diagnosis, and then they went and got their tonsils out, but nothing changed. Just like, oh, well, it's because we didn't do all the other things.
Exactly.
Yeah.
Exactly.
Yeah. It's crazy.
Okay.
It is. It's disheartening too.
It is.
Okay, I have a question.
That's why we're doing what we're doing, is raising awareness.
And I'm going to
Exactly.
be referring so many people to you that I work with after this, by the way.
Well,
You're going to get an influx of like, heard you from Jessica. Jessica referred us. Jessica referred us.
well, I would love to see them. I'd love to help you take care of them
Yes.
and help them take that next step. If the therapies that I provide can help the patient, progress.
Yes.
You do see
Just so
pediatric
happy.
clients, though.
Yeah.
You're set up to see peds. Perfect.
Yes.
Great.
Yep. Yeah, you're getting a lot of referrals coming your way. Hopefully. Hopefully.
Do you have a myofunctional therapist on staff? I thought you did.
We don't anymore.
Okay.
Yeah, we don't anymore. But
Okay.
even then, when she worked independently, so she had her own business.
Gotcha.
So she did evaluations in my office, but that was it.
I see.
But we want to have a broad referral or referral base. And so that was advantageous in the sense of we want patients to come in. I want to be the coordinator of treatment because I feel like my unique position is that I'm not a specialist in any one of these in any one of these specialties. So I feel like I can a little bit more unbiased look at the range of treatment modalities and say, hey, these are the ones we should look at.
Yeah.
To be able to get a comprehensive approach. So then I'll say, hey, you need to go see. I recommend seeing an OT and a body worker, or let's meet with a speech language pathologist or myofunctional therapist or ENT.
Yeah.
And then I like to manage the treatment plan and get feedback from these providers to say, like, okay, let's continue to guide. Because then when it comes down to it, looking at jaw size is something I do. So tooth alignment, jaw size, to make sure they are growing and developing as they should, and that their oral environment's healthy, that their cavities risk is low, that their gums are okay, and then of course if they need lip, cheek, tongue tie releases, then I can provide that.
Okay.
So what are some good ways to keep the oral microbiome healthy?
Breathing through the nose.
Okay, what else?
Breathing through the nose, frequent removal of plaque.
Brushing with water.
Brushing with water, or using, a product that's simple and safe. Not sipping on anything besides water.
Oh, man.
So...
My doctor is literally like, you need to have electrolytes in every bottle of water you drink.
Yeah. No. It's those. I'm a huge proponent of electrolyte drinks, but they need to be drunk in less than 30 minutes. So because they have citric acid in them, that's what gives them their tart, fruity flavor. And they have salt, and salt binds calcium. So calcium isn't available to get to the teeth to remineralize, and citric acid is one of the most harmful acids for teeth.
Perfect.
Yeah.
Great.
So I have seen patients that never had a cavities problem and then started sipping on electrolyte drinks.
Oh, stop.
And then it impacted their oral microbiome enough that they then had rampant cavities.
Okay, so 30 minutes for your electrolytes.
Yes.
Okay, what else?
Yes. So snacking, sticking with fat and protein only in between meals. And, some patients have resilient microbiomes. Some patients can get away with not doing a lot of these things and be okay. But it's just not worth the risk. And certainly if you do have a history of cavities and gum inflammation, then these things are extremely important.
Yeah.
And then we've created guides that really get into all the risk factors and all the actionable items to be able to address the issue from every side and every risk factor.
Yeah, I know. I'm just thinking of all the kids that we work with that, have limited food rapport. They only like to eat crackers and cookies and goldfish, and I'm just like, I bet their oral microbiomes are just a hot mess.
Yeah they really can be. So with those patients, trying to implement more brushing, if possible,
like in between those meals.
Especially after those snacks, especially crunchy carbohydrates, dried fruit, anything gummy sticks in the teeth.
Brush after.
So brush after. Try to floss the child's teeth. There's some on our products guide. There's some things like an electric flosser that make it really easy.
Oh yeah, but like a water flosser. Don't they have like water flossers?
Yeah, water flossers too.
That'd be good.
And then xylitol is a big thing. It's scientific evidence shows that it reduces cavities risk and it promotes oral microbiome health.
And you said that there's like sucker versions of that. So I mean, kids love suckers.
Yeah.
So
I got the Epic mints, I think, that you guys recommended.
Yes.
And my kids love. They have like citrus flavored ones and mints and stuff. So I just
replace all the candy with just those.
Yeah. And they taste. The nice thing about xylitol is it tastes like sugar, unlike some sugar alcohols. Something important to, it's not an artificial sweetener. So it is a sugar alcohol, and xylitol is found in our bloodstream. It is a byproduct of glucose or other sugars being broken down in the body. Another neat study that was conducted shows that a nasal spray, xylitol nasal spray, specifically clears, the one that has the studies on their website. Increases the microbial diversity, or the diversity of the good bacteria in the nose, throat, and lungs.
Wow.
And xylitol is one of the few prebiotics that can get all the way down to the colon.
Interesting.
And xylitol is associated with an increase of bifidobacterium in the colon, which produce antioxidants, which are very good at addressing gut inflammation. So it's underestimated and it's villainized, but it's just misunderstood.
Interesting.
But it's a really great tool that we have today.
Okay, what about, like, I saw someone who had a kid who had cavities, and she was like, give me 6 months and I will cure them. And she did, I don't know if you're familiar with Just Ingredients, but she has like a tooth remineralizing powder. And I think that was one of the things that she used. Is that a thing?
Yes, we can reverse cavities to a degree. So they have to fall in a specific category. There can't be a physical hole in the tooth.
Okay.
So that's a start. Once there's a physical hole in the tooth, it's physically impossible to remineralize because enamel is not a living tissue.
Okay.
So it's like cutting off the end of your fingernail and expecting your fingernail to grow from that edge forward instead of from the nail bed. Mm-hmm. It won't.
Okay.
Right.
It's impossible. So, but yes, as far as remineralizing cavities, but it's a multifactorial approach.
Makes
so
sense.
It's not a product approach
Or a one size fits all.
or a one size fits all.
Yeah.
You know, if these specific risk factors, it's like you can use any product you want. And that's my problem with the product industry is they focus on, we can do this. But if you don't address mouth breathing, it doesn't matter what product you use.
Yeah, it's going to come right back.
Yeah.
Yeah.
But if you do address mouth breathing, you don't need to use a product to get better because
Totally.
the saliva is the natural maintenance system in the mouth. So saliva most effectively remineralizes cavities better than any product.
Yeah, if there's no issue with the microbiome.
Exactly. So we get the microbiome healthy and we have enough saliva, and that saliva is healthy. That is the best thing at maintaining our oral health. The saliva is designed
what it's made to
by
do,
nature
yeah.
to remineralize teeth because every time we eat something acidic, our teeth demineralize. They form the start of cavities. So that's the problem with sipping electrolyte drinks is it keeps the mouth in that acidic state and it continues to pull minerals from the teeth versus when the saliva, you have your drink in 30 minutes, then your saliva comes in, it brings the mouth back to neutral, and then it floods the mouth with the minerals that the teeth need to remineralize
Okay.
and not get cavities.
Dang.
Wow.
I definitely take more than 30 minutes to drink my electrolyte water.
Oh, yeah.
Because it's in my giant water bottle.
Yeah.
It takes me a couple hours.
Those are hard to drink.
Yeah.
It's a lot of salt to chug down in 30 minutes.
Yeah, no kidding. Okay. We've opened a lot of can of worms, which is great. I love all the worms
It's
and all
been a
the
lot of fun. I love
all
this.
the things. This was great.
Well, I feel like we could go on and on and on.
We could, yes. But I just want to say thank you for coming on. I mean, this was very eye-opening for me, not as much for Jessica.
I mean,
she knew it all already.
It's validated the other things I heard, so I feel good about it.
Well, I thank you so much for having me.
Yes.
I am passionate about getting the word out. And I'm especially passionate about the evidence-based approach that I take. Because I feel like that's something that's often overlooked at large is approaching the whole issue, all of the issues from an evidence-based approach.
Yes.
Well, especially with social media today. Anybody
Yeah.
on social media can say anything and it can go viral and then,
Yeah. Oh my gosh.
Yeah.
Yeah.
You do share a lot of helpful tips on your Instagram and TikTok and all the things. So we'll make sure those are all linked in the show notes as well so people can follow along and learn. And if they're open to it, great. If not, then they can just move on and keep doing their thing, which is fine too.
Yeah, and we have a lot of bonus materials and guides that we've spent thousands of hours on really to fill this need in oral health to actually teach what's going on and what to do about it.
Yeah. Well, thank you so
Amazing.
much.
Thank you.
Yeah, you're welcome. Thanks for having me.
Yes. Thank you so much for listening to All Things Sensory by Harkla.
If you want more information on anything mentioned in the show, head over to harkla.co/podcast to get the show notes.
If you have any follow-up questions, the best place to ask those is in the comments on the show notes or message us on our Instagram account, which is at Harkla_family or at All Things Sensory Podcast. If you just search Harkla, you'll find us there.
Like we mentioned before, our podcast listeners get 10% off their first order at Harkla. Whether it's for one of our digital courses or one of our sensory swings, the discount code SENSORY will get you 10% off. That's SENSORY.
Head to harkla.co/sensory to use that discount code right now.
We're so excited to work together to help create confident kids all over the world. While we make every effort to share correct information, we're still learning.
We will double check all of our facts, but realize that medicine is a constantly changing science and art.
One doctor or therapist may have a different way of doing things from another.
We are simply presenting our views and opinions on how to address common sensory challenges, health-related difficulties, and what we have found to be beneficial that will be as evidence-based as possible.
By listening to this podcast, you agree not to use this podcast as medical advice to treat any medical condition in either yourself or your child.
Consult your child's pediatrician or therapist for any medical issues that he or she may be having.
This entire disclaimer also applies to any guests or contributors to the podcast.
Thanks so much for listening.